Hey guys, so I just wanted to share my sinus surgery experience. Um, Earlier this year, I was looking for other videos about it. I wanted to learn about other people's experiences and I couldn't really find anything. So I have my system bullet points here, so I might be glancing down at that. But yeah, I'll tell you kind of about it from the beginning, the cost, what it was like, the recovery, and what to expect. This is just my personal experience with it, and no means a medical professional. But I just want to give you a heads up on what could happen because it's what I went through. So, what happened is it's kind of like for years I had sinus infections and I was very swollen, like couldn't breathe well, kind of restless sleeping, and it just increased over time. It got worse and worse and worse, where it affects a lot of things. So in 2016, I finally went to an ENT. My father had had two sinus surgeries as well. I figured, okay, this is just something genetic, so I should look into this. I'm suffering a lot, constant allergy issues, right? Like I'm the person whose pockets are like always stuffed with tissue. I have a tissue box by the bed, tissue box in the car, like tissues in my purse. I can't go anywhere without tissues. And I'm like, okay, I need to check this out. Especially because at that time, 2016, I was 20, well, I was about to be 26. And if you're not from America, at least in this day and age, when you are on your parents' insurance, they kick you off at 26. So I knew that for an expensive surgery, and I didn't have a job where the healthcare was really good. It was a really crappy plan and it would have been really expensive. My dad worked for a city and so he had good benefits. So I was like, okay, I need to jump on this before I turn 26. So I went ahead and consulted with an ENT. I had been in grad school in 2016 as well. So I was in my second semester of grad school for my master's. And this ENT, explained how it would actually be two surgeries. She couldn't even do it herself. Like normally for a sinus surgery, if it's more common, I guess, they can just do it in the office. But mine had already progressed so much, which I didn't understand at the time. It had already progressed so much that she needed to send me to a specialist at a hospital to do this. It couldn't be done in office. It should have been a red flag for me, but call me stupid. I decided, well, it's going to take two surgeries, probably a week and a half to recover after each one. I heard horror stories from other people about how they, after the surgery, they pack your nose with a bunch of cotton packing just all the way up, right? Because, it's like raw and bleeding. And then afterwards, after the surgery, they have to pull it back out. So I don't know if that's what she was talking about. Like I needed two procedures, one surgery and one for that. Who knows? Or it could have just been there's so much to cut out in there that she needed to do two surgeries. Who's to say? Anyways, I had a CAT scan, then I had an MRI, so they could see the extent of everything. That's when she said I needed to go to a specialist and take all that time off of work and all that time off of school. Well, in grad school, at least at the school I went to and the program I was in, if you're missing more than 1 week, some classes will drop your grade, a letter grade, or you end up failing, missing 2 weeks, you're probably going to have to restart the semester. So knowing that I would have to go probably 3 weeks missing classes, it wasn't an option for me. I wasn't about to restart the entire semester, all that money wasted. I was paying for school out of pocket. And then there's the expense of the surgery. And then I don't get paid time off, so then I'm just losing money as well. So it was like a trifecta of reasons not to get it at that time. So I was like, okay, I'm going to hold on to these scans that cost me hundreds and hundreds of dollars, and I'm just going to wait till after I'm done with school. I'll do it then. So fast forward, we're in 2018. I am about to graduate school. It's a 3-year program, essentially, it can be. And I decided, okay, I'm on my fiance's insurance. I'll go check it out, see what the damage is. And this whole time, from 2016 all the way to 2018, my sense of smell had started to disappear. um, the swelling, the pressure, oh my gosh, like this pressure, the sinus pressure just increased little by little where it was really bothering me. I couldn't breathe through my nose at all. It was like a complete brick in my face. So I would have to sleep with my mouth open and have to sit there and just talking to people, listening. I got out of breath like going upstairs, and I'm not like an overweight or non-active person. Like I like to go hiking, I like to go to the gym, I like to do stuff. So for me to walk upstairs and be out of breath, it's just I couldn't get enough oxygen. Because I was sleeping with my mouth open all the time. Well, my mouth would dry out. And that just, it affected my teeth. Like I started to get really, my gums were extremely sensitive behind my front teeth. It looked swollen and raw. Every time I went to the dentist, they were pretty alarmed. Um, it started to affect things, and then socially, of course, and then mentally, because you're sitting in class and especially if you're sitting in a circle and you're that person with their mouth hanging open, it's just weird. So it was time. Like I couldn't taste things as well. The cool thing was I was able to like heap on the hot sauce and wasabi. Didn't I mean I'm okay with some spicy food, but I could really heap it on at that time because I couldn't taste anything. So yeah, I was like, this is bad enough. I need to fix this. So I went to a different ENT, and again got the same kind of answer. Like I can't even get like they use a scope, to the little like straw looking thing with a camera and light at the end. So he was like, I can't even get like the kid one up your nose. Like I need to send you to a specialist. Like I can't even touch this. But he approached it a little bit differently. He was saying that um, he was like, I want you to call this guy. I'm going to tell him about your case. If they try to schedule you for like a few months out, don't let them. You need to get in there like this week. And I was like, okay, he sounds pretty serious. This is kind of freaking me out. So called the place. They said, oh, it's going to have to be like a few weeks. I was like, I was hoping for this week, like talk to my doctor about this. And they were like, no, it's going to be a few weeks. So I'm not a fighter. I'm just like, okay, if that's the best you can do, it's the best. All right. So I get a call back later that day from one of the nurses there, and she's like, oh, yeah, we spoke to your ENT. Can you make it tomorrow? We would like you to come in tomorrow. So I was like, okay, this is sounding more serious. So I went in the next day, met with the specialist, an otolaryngology specialist. I was diagnosed with allergic fungal sinusitis. My understanding of that is I'm essentially allergic to a fungus in the air that's present in the South US. So I don't know where this is in other parts of the world or in the US. I just know it's more prevalent in the southern states, and I live in Texas, so awesome. It's the same thing my father has, so I was expecting that. And then the surgery, it was called a total bilateral, so both sides, ethmoidectomy, ectomy being removal of. So what happened is they would go in, no incision, no bruising, just swelling afterwards. They would go in through my nose, I guess, cut out some tissue, suck out some stuff, and hopefully I would be able to smell after that and have a better quality of life. So I was looking forward to that. Kind of freaked out that they were going to be so close to my brain. So I'll tell you a few details what made my surgery so serious. The pressure had built up so far, like so much, that it was the tissue just constantly swollen. So, pressure headaches. But so this kind of thing left untreated, it'll start to pop out like your bone, like it'll pop out people's eyes. If there wasn't a surgery for it, like it would just progress until you're dead. So what was happening for me is it was getting the tissues and everything, the swelling, my sinus cavity is just going to expand. And it was getting really close to hitting my optic nerve. And that's what was freaking them out. They were like, we need to get this done as soon as possible, or there's a chance you could lose vision in one eye. don't really want to go blind. I already have crappy vision. So, yeah, that was incentive. The other part is the pressure was so constant and so chronic that it had actually eroded the bone between my sinus cavity and my brain. So it eroded part of my skull. It's gone. Like, bone will grow back a tiny bit, but it's never going to completely cover that entire area. So, also freaky. Which also freaks me out with surgery because I'm like, is there a chance that you can go up my nose and hit my brain? Like, how do you know you're going to be careful? So, a few cool things about it. It is 2019. Thank God. Like, technology and medical technology is so advanced now. It's so much safer now than it is in the past. Like in the past, the surgery had a high rate of complications. Now they can do I think it was like a live MRI. So as they're, getting close to the brain, like trying to cut something out, they can see exactly where their instruments are in proximity to my brain, like on a screen. Like they can just see it in my head. So that's why there's no incision or anything. So I'm like, okay, that's pretty cool. So you won't hit my brain on accident. The other part of having it done this year, as opposed to in 2016, is that they don't use cotton packing anymore. I was so shocked. I was so happy. That was like the worst part of it from everyone I've known. I've known 4 people who have had sinus surgeries, and 2 of them got infections afterwards, which makes sense when you're pulling out a bunch of cotton and it's raw and you're just, I'm assuming, ripping the scabs or disturbing that area even more. Anyways, they I guess medicine finally realized, like, yeah, it's not really helpful. It kind of sucks for people. It kind of causes issues. There's no need for it. So don't do it. So thank God. So I wasn't as scared of the post-op. So no splints, nothing. So I'll tell you about it. Let's see. So the process, that's what I want to talk about next. Showed up to the surgery area, showed up to the hospital super early. Gosh, it must have been like, I want to say 5:45 a.m. I was there. No, I've never had surgery before this one, so I didn't know what to expect. So, of course, they give you guidelines. They tell you, don't eat after midnight. You can have a tiny bit of water in the morning, and don't have like anything on your body. No nail polish, no earrings, no makeup, no lotion. I don't even think I wore deodorant. Just keep it as simple, like, oh, no contacts. Like, I wear contacts. Without them, I can't even see the big E. So it freaked me out when they had to take away my glasses. So I'm just like, oh, where are you wheeling me off to? Oh, and I'm drugged. So it was, yeah, no rings, no jewelry. Get all of that out. Yeah. So that was that part of it. They allowed my fiance to be in the room with me while all the nurses were getting me ready. Of course, putting on the hospital gown, no bra, no underwear. And yeah, so he was there to like chill with me. And I was nervous, of course, but it was nice to have someone there to comfort me. I had my surgery done at UT Southwestern, in case you're in Dallas and you were wondering. Awesome, awesome, awesome nurses. Super freaking nice. Like, I was shocked. I've never had anyone, like any professional, be that nice. And I work in customer service. So that was really cool. Very sweet, very patient. And they, repeatedly checked my vitals. Of course, they marked my nose, so they knew where they were operating. Every time they came in, I had to say my name and date of birth. And then finally they made my fiance leave, and they wheeled me down the hall. They moved me from the little rolly bed, the stretcher, I don't know. They moved me from that onto the other hospital bed, which obviously I kind of scooted over, like I was still awake, even though I don't know if I had the anesthetic at that point. This was 7 months ago, so I'm just trying to use my memory to the best of my ability. But yeah, then of course they give you kind of that final push of anesthetic, and then you're kind of like counting. I think I asked them to take pictures, which they didn't. One of my other friends had brain surgery, and the doctor took pictures for her, so I knew that was a request I could make. But I guess they forgot. I don't know. But anyways, I passed out pretty quickly, and then some people say that after you pass out and then it feels like you just wake up. Like, you have those nights where it doesn't feel like you dreamt or anything, like you didn't even sleep, you just hit the pillow and then you're up. It wasn't like that for me, which was surprising to people, because I guess it's supposed to be more like you snap awake. But it was a kind of a gradual awakening where I did feel, I don't know if I was dreaming, but I was more aware of sleeping when I was waking up. I don't know if that makes sense. Anyways, waking up was freaking terrible. I wasn't sure how I would react to the anesthetic, but the nurse assured me that my reaction for a young female, I'm 28 for reference, so younger females tend to have a lot of nausea when they wake up from the anesthetic. And I woke up having a panic attack. Did not expect that, and so that was terrible. And when I say panic attack, I mean I started to wake up and immediately like sort of hyperventilating, got really nervous, heart rate shot way up, and obviously I was very nauseous. So eventually the panic attack subsided. Nausea took a little bit longer. My fiance spoon-fed me some applesauce and I had sips of water. So expect that. I mean, you're just so out of it, you don't even want to move. It's just like you are just completely exhausted. The pain, they give you painkillers, they're pumping it through the IV, so I didn't really notice the pain, just some discomfort. And then once I was more awake, I was just super groggy and just like exhausted. I could finally get dressed and I just wanted to get out of there as soon as possible. So later that day, I was out. Surgery took a few hours. I can't tell you for certain. I'd have to look back at the notes. But it took a little longer, I know, than my fiance expected. He waited there the whole time. So it took a few hours. I want to say 4. And let's see. What else? I guess I could jump to the recovery. So I had the surgery on a Monday morning, and I had a wedding to be to Friday. So we decided, it was in Arizona, and again, I live in Texas, so we decided we can drive it. It's like a 17-hour drive. That was dumb. So we left Thursday and drove there. I didn't drive because I was still taking codeine. Before and after the surgery, I was taking prednisone. That's a steroid, so you just take the pills. They have different like milligrams, different strengths. So right after the surgery, to make sure like the swelling just doesn't reoccur, I was on 40 milligrams, which to my understanding is pretty high, and did that for like 5 days. And then I had 30 milligrams for like 5 days, then 20 for 5 days, then 10 for 5 days. And then let's see what happens. There's no like set course of treatment for this. They're still trying to figure out a lot about allergic fungal sinusitis. But it is common for people to have more than one surgery because I can't escape the air. I'm allergic to the air. Like I have that immunoresponse. Everything starts to swell and I'm sneezing and then it swells so much that, fungus gets trapped. I mean, it's inside of your sinus cavity. It's warm, it's dark, and it's like it's trapped in there. Like it's humid. Like it just is going to grow, which means my body's going to continue to react to it because it's in there, which means just swelling. So we do, I have to do what I can to fight the inflammation. So prednisone is one thing that helps that. Thank God I was weaned off of it. I was super bloated, uncomfortable. I felt just awful. I don't know, like not like flu-like, but you just, you feel off, you feel crappy. That's how it was. And it wasn't just because I had surgery. It was the steroids for sure. So again, there was no bruising or anything like that. I was just a little swollen up here. I had to rinse my nose. I think it was no, it was twice a day. It was twice a day. I still rinse my nose, and by rinse I mean like irrigate, like use a saline solution all the time with like a neti pot or this thing, the Neil Med rinse. You just pour the little saline packet. I don't know if you can see that little saline packet in there with some warm water. Oh my gosh, always use distilled water. So make sure, this is like 88 cents at Walmart. Always use distilled water, or make sure you're boiling it or something, purifying it. Do not ever, ever, ever use tap water, because you're putting this solution, you're like pouring it in your nose through your nostril by your brain and then out the other side. And so you want to make sure that that water is clean as hell. Otherwise, who knows what you're going to get. You're going to get some freaky brain eating something. So there's that. So I do that either right now, so 7 months later, I do that every day or every other day, depending on how dry my nose feels, right now the weather's changing, it's becoming fall, so I don't know what's being kicked up or what's happening, but my allergies have been terrible lately, feels like really just irritated, so I've been doing it every day, just once a day. It's a pain, but yeah. So it's ongoing maintenance because, again, I'm allergic to the fungus in the air. I can't escape it, so it's a chronic condition. The other thing I have to do, I'll show you this, is I have these drops. So it's called budesonide. And you notice it says inhalation suspension. I guess people normally pour this into, I forget what they're called, but the little things that like you use to kick up the vapor and then you inhale it for like asthma and stuff. Well, I don't use it the same way. So they come in these like foil packets. You're supposed to keep it, away from light. That's why they're in the foil. And they look like this. They're just a bunch of these things. And so you break them apart. And then you will twist off the top. And I have to like lean over a bed or something, lean back, and just nostril to nostril, go back and forth and squirt it in my nose. And I'm talking about like I'm looking at the ceiling. I'm all the way back to make sure that it drains as far back as it can get. And then once you lean forward, it slowly will come down. Sometimes I blow my nose afterwards. Sometimes most of it's absorbed. So another steroid treatment where it's more local instead of the prednisone, which goes through your whole body and has a whole bunch of effects, especially when taken long term. This supposedly will have less side effects on me. So that's one thing. There's also this new steroid like nose spray powder type thing. So it kind of looks like if you put a little, I don't know, like a little spigot on a Flonase, like a normal thing. I should have brought an example. But you stick it up your nose and you blow into part of it to shoot the powder farther up your nose. Because if you just squeeze it, it's gonna get to like right here. It's not gonna get all the way up where it needs to be. So that's a thing. Don't use it often. It's very drying. I prefer to have liquid in my nose. Feels a lot better. So yeah, these things though, the little steroid drops, I was doing them twice a day in addition to doing the like irrigation or neti pot twice a day immediately after. Every time I would irrigate, my nose would bleed. It still bleeds some to this day, and I'm not talking like a nosebleed. It's not gushing blood or anything like that. But when I blow my nose, or after I do a sinus rinse and I blow my nose, there's definitely blood or dried blood in the tissue. Asked about that. Doctor said it was normal. Okay. The other thing is, I guess some people still can't smell right after the surgery. I could. He was really surprised that I could smell, but I could smell immediately, which was awesome because, it's crazy. Like, if I had to lose a sense, okay, I'd pick smell. Like, it's not necessary for survival, but there were a few instances where not having smell was very maddening. There was one time I was driving a crappy car and it started smoking under the hood at a red light. And I was like, oh my God, like, is my car about to like catch fire? What's happening? I can't smell anything. I can't smell what type of smoke it is, if it is a fire. Um, there was another time the actual fire alarms went off. I think it was just like a battery issue. I wasn't cooking. It was the middle of the day. Nothing was on fire. Nothing was hot. Like, it just went off. But it freaked me out that I couldn't, use all of my senses to try to figure out what's going on. So I was really happy to have that sense back. In addition, like, food tastes awesome now. So that's part of it. Let's see. Uh, an unexpected thing. I mean, I knew it was going to happen because I couldn't say, you're soft up all the time. So you're like, B, P. Like, no one can understand me. It was awful. And look, I can breathe now. But I'm a little stuffy because allergies. Yeah, my voice changed. Everyone told me that. Everyone I talked to was like, whoa, you sound different. Yeah, because air can now flow through my face. So that was another interesting, I guess, side effect, result from the surgery. And then going forward, I just have to see an ENT every 6 months at least, just like going to the dentist to check up, make sure that we're doing what we can to prevent the inflammation from growing back. I have a sugar addiction, but I try to usually have a pretty low inflammatory diet. I'm eating lots of like fish and blueberries and yeah, like not a lot of cheese and other things. So there's like all these lists online. I have it posted on my fridge, but I try to be good about eating healthy, eating lots of whole foods and fruits and veggies, doing whatever I can to fight this because I don't want to have another surgery. It's expensive and it sucks. I think when my dad had his in the ENT office, it was probably around, now he has Cigna and he works for the city, so he has pretty good insurance. But I think out of pocket, it was about $2,000 for him, which is, I'm assuming, his deductible. For me, it was about the same out of pocket, and I was on my fiance's insurance when I had this done, also Cigna. And the actual surgery cost, like just the raw cost of it, was probably, I want to say like 23,000, somewhere in there, like somewhere between 22 to 25, so 23,000-ish. And then my portion, once I hit my deductible, was about 3,000. So I think all in all, of course, you can get on a payment plan with no interest at least every hospital I've been to. Yeah, I think all in all, it was probably close to 5,000. So 3,000 from the surgery. And then like this specialist, my first visit was the pre-surgery consultation was $970. $470 just for seeing him, $500 just for using the scope. Weird thing is afterwards, when they could finally get that scope up there, I could see my brain on the screen. And it is the weirdest thing to have a light shining, not, in front of you, but a light shining out of your face. Like it's so weird. You can like tell, you can't see light, but you can like tell that there's light. Like everything's bright because it's a light in your face. Weird. Anyways, yeah, when they use that scope, it adds a lot of cost. So going forward, I can see a normal ENT now. I don't have to go to the specialist unless I need another surgery. So we'll see how it goes. But so far, I'm really happy with the results. I never had an infection. Oh yeah, right, post-op as well. Forgot to mention, they give you antibiotics. Like they're making sure you don't get one. So you have prednisone, antibiotics, and sinus irrigation, like the little rinse that you need to take constantly. And so I had like all these timers set on my phone and writing down the times for everything because everything is like, do this 2 or 3 times a day and do this like twice a day and do this one like every 12 hours and or whatever. And then you have codeine, so that's every 6 hours or whatever it is, every 8 hours, probably don't do 6. Yeah, so that part only lasted, about a week, probably 5 days after the surgery. Like by Friday, I wasn't taking codeine anymore. So it's discomfort more than pain. But yeah, really happy. Glad I had the surgery. Glad I had it in 2019, not 2016. And recovering well. They also fixed my deviated septum. That was a thing. I think maybe it was overcorrected, or there's just scar tissue that built up because now this side is more closed off than this side, and this side was like for my whole life the more closed off side. So it's like they went too far. I don't know. Anyways, yeah. If you have sinus issues, get it checked out because it could explode into a whole other really expensive thing that could potentially cause you to go blind. So if you have any questions, post them down below. I'd be happy to either make another video or try to answer them. But I just wanted to give you all my story and tell you a little bit about what my journey was like. Bye.